Hi, my name is Chrissy Smoot, and my topic for the Junior Breakthrough Challenge is schizophrenia. When people think of serious illnesses, many think of Ebola, the flu, and other physical illnesses. Many don't think of how serious mental illnesses can be. Schizophrenia comes from two Greek roots, schizo and phrenia. Schizo means split, and phrenia means mind. Schizophrenia is a mental disorder that interferes with a person's ability to think clearly and decipher between reality and fantasy. Each individual who suffers from schizophrenia experiences different symptoms. Some common symptoms of schizophrenia are: first, there's hallucinations. One example of hallucinations is hearing voices. These voices can be threatening, critical, and sometimes the person hearing these voices can recognize them, or they can be completely random. Another example of hallucinations is the person suffering from schizophrenia will see things that others will not. Another example of hallucinations is the person suffering from schizophrenia will smell things that aren't necessarily there or that others can't smell. Another symptom of schizophrenia is delusions. People who experience delusions believe that they are extremely real and also have troubles concentrating and thinking. The last common symptom of schizophrenia is negative symptoms. People who experience negative symptoms do not show much emotion, their voice is monotone or dull, and they have very little interest in any daily activities. Sometimes someone who suffers from negative symptoms can be clinically depressed. Here are some myths about schizophrenia. A very common myth about schizophrenia is that schizophrenia is the same as multiple personality disorder. Another myth is that anyone who has schizophrenia is very dangerous. There are actually only very few people who suffer from schizophrenia that are dangerous.
Now for the facts. It is a fact that schizophrenia affects about 1% of the US population. Many people believe that schizophrenia is a rare disease. This is not true. Schizophrenia is not rare. Another fact is 1 in every 100 people suffer from schizophrenia. My last fact is schizophrenia starts to appear in men from the ages 15 to 25. Schizophrenia starts to appear in women from the ages 25 to 35. Scientists are not exactly sure what causes schizophrenia, but they do have some ideas of what can contribute to schizophrenia. First is genetics. Scientists believe that schizophrenia isn't caused by just one genetic variation, but a complex interplay of genetics. Scientists also believe that brain chemistry has a part in the development of schizophrenia. They believe that there are problems with certain chemicals in the brain, including neurotransmitters such as dopamine and glutamate. Using drugs in your teen years can increase your chances of developing schizophrenia. Smoking marijuana can increase the risk of psychotic experiences and breakdowns. Diagnosing schizophrenia is one of the hardest things to do. This is because many drugs have similar symptoms to the symptoms of schizophrenia. Another reason why diagnosing schizophrenia is very difficult is because the person who suffers from schizophrenia does not believe that they have the disease. There's no specific test for testing the diagnosis of schizophrenia. A healthcare provider would have to evaluate the person who's suffering from these symptoms over a period of 6 months to ensure that it is, in fact, schizophrenia. How schizophrenia affects the brain. Brain scans show that people who suffer from schizophrenia have a lack of brain tissue and a less than average cranial size.